Hi, in this video, I'm going to talk about how to care for a parent and yourself when your parent has breast cancer. We get a lot of questions from you about, in particular, your mothers. Your mothers are so fortunate to have you. Before I go on, I want to encourage you to subscribe to our channel. We put out several videos a week, so there's always new content. So you have a parent diagnosed with breast cancer. There are a lot of things that may come up for you. How do you provide the best care for them? How do you handle what may be a change in your relationship? And how do you care for yourself? I'll go through all three of these. So when a parent is diagnosed with breast cancer, there are a lot of things that they fear that you can help them with. They fear loss of autonomy. They fear that they're going to be a burden on you or other people in their family. One of the key things you can do for a parent with breast cancer or any type of cancer is help them preserve their autonomy. And what I mean by that is let them do as much as they are able to do. Do not do everything for them. Do not schedule all their visits if they're capable of scheduling their own. Do not ask all the questions or write up all the questions for the doctor if they are able to do that on their own. You might think that you're being caring, and yes, you are, but one of the key elements of dignity is autonomy. And you want to preserve your family members' dignity by preserving their autonomy. The other thing you can do for them is be a source of understanding. You do not have to fix everything. In fact, it's very unlikely that they're going to want you to fix anything. People don't want to be fixed. What they want is for somebody to listen to them. So you don't have to argue if they say, I'm scared I'm going to die. Arguing would be to say, you're not going to die. Validating can be, it's really normal to be scared about that. And if they ask you, tell me I'm not going to die, you can say, we're going to do everything to keep that from happening. So you're responding to what they've asked for without undoing their feelings. We don't want to put people at war with themselves. Now, you may be watching this and saying, my parent would never ask me this. My parent doesn't talk to me that way. You know, a parent has been a caretaker their whole life, and all of a sudden, you're there to be a helper. And that can be very uncomfortable for them. It's a whole different change in their role. You know, even when I have a cold and my kid does something nice for me, I'm a little uncomfortable with that. I love it, but I also am happy it's not going to last for long. So don't be surprised if your parent holds you at arm's length and wants to talk to people their own age, or their partner, or their siblings, or even their parent. They may not want to talk with you about all their emotions if they haven't had that kind of relationship with you before. They're used to being the strong one in many cases. So respecting that and any distance they want to keep can help you too. If you don't have a relationship where you talk freely, trying to create one right now is going to be extra effort for both of you and won't really fix anything in the meantime. If you find you are having your own emotional response, and how could you not, think about getting your emotional needs met elsewhere. There are support groups for family members with cancer. You have your own support network. You can talk with a therapist. You can talk with your own doctor. It is extremely destabilizing to have a parent diagnosed with cancer, and taking care of yourself is very important. So what other things could you do for them? Well, you may offer to do the research, going on the internet, watching our videos. They may not be into all that internet stuff, or they may not be, interested in watching YouTube videos, but you can, and you can take notes. You can learn as much as you possibly can so that you can be a sounding board for your parent after a doctor's appointment. You can help interpret their pathology reports with them and explain terms to them if they ask. And one way to find out if that would be helpful is to ask, would it be helpful if I did research about this? Would it be helpful if I looked at your pathology report? Just ask permission. That's a really good way to navigate that autonomy, helping out balance, because it's not going to be all or none. It's not going to be they want 100% autonomy or they want 100% help. It's going to be autonomy and help. So you can ask, what kind of support would be useful to you? The other thing that can be really helpful, just like with anybody who's been diagnosed with cancer, is instrumental support or practical support, doing errands, picking up dry cleaning, flipping over a load of wash, helping somebody right after surgery. Your parent may be willing to let you stay with them the first few days after surgery, but ask what is helpful. And those are some examples that you can give them. So how do we cope? We cope as we would anytime we're children of a parent who's having a problem. We have to cope by asking what they need and realizing they still need their autonomy. Taking away their autonomy is a way of bruising somebody's dignity. Also, telling them how to feel, not letting them voice their concerns or arguing with them about their feelings is invalidating and is a way of violating their dignity by bruising the understanding element and acknowledgement element of dignity. And then finally, take care of yourself. If you run yourself ragged and you're up all night on the internet and going down internet rabbit holes, you're not going to be much use to them. And meeting your own needs will help you be the best help you can to them. And as always, drop a comment or question about your experience helping a parent with breast cancer. You are helping the Yerba community when you do that. If you have a question, drop it below as well, and we try to get back to you within a week or two. Follow us on Instagram, and as always, an invitation again to subscribe to our channel. Thanks for watching.